Let's take a look at what a PT evaluation may look like for somebody hoping to manage a labral tear without surgery. While everyone's evaluation may look a little bit different and will be case by case based off the individual that they're working with, there are some commonalities that you'll find amongst all clinicians and how they approach the treatment and evaluation of hip labrum tears. First off, after you go through your subjective dialogue and you're going through how the injury happened, what types of things are aggravating, how long you've noticed the symptoms, what the types of symptoms feel like, they're going to get into what they'll call the objective portion of the evaluation. This is when they're doing certain tests to differential diagnose and make sure that they're actually working with a hip labrum tear if you have not already gotten MRI or other imaging to confirm this. Tests that you'll commonly hear referred to are a Faber and a Scour test when you're looking at hip labrum tears. Following that, it's common to go through some different range of motion and flexibility testing. This will give an idea as to how much range of motion you may have lost as a result of the hip labrum tear, or how a lack of mobility may be influencing the presence of the tear or some of the symptoms that you're having associated with the tear. Following range of motion, you'll move into a strength assessment. And this is going to be a pretty broad assessment, and it'll most likely start on a table where they're doing some isolated manual muscle testing just to see how well you can activate and find different muscles in and around the hip and how they look and feel compared to the injured side and the uninjured side. It's not uncommon to find some asymmetries between how the actual muscle feels when you're utilizing it, meaning does it feel strong, does it feel weak, or does it provoke any discomfort, but also are there any large differences between different muscle groups on the same leg or from one leg compared to the other. Following the table-oriented testing, you'll come off of the table, and it's common to do more of a functional-based assessment. So we're going to look at things such as balance. We'll look at different movement patterns such as squatting and lunging, seeing how well we can move with regards to range of motion, how deep we can get into these positions. We're looking for things such as provocation of pain, and also if it is related to a certain direction or position that you're going into. This helps further with our differential diagnostics. It also gives us an idea of where are areas for opportunity in regards to maintaining and building strength and stability to help treat this conservatively and hopefully avoid surgery, or if you do go the surgical route, to put you in the best possible position going into that. Physical therapy care for hip labrum tears is often centered around symptom management, which can be a combination of education on how to avoid provocative positions and activities, or how to modify them to make them more tolerable in the moment, and then transition to them back to full participation in the future. They may go over icing versus heating, the benefits or the utilization for over-the-counter medications or prescription medications, and teaching you who is the most appropriate medical professional to direct those questions towards. Manual therapy such as soft tissue mobilization, dry needling, cupping, instrument-assisted soft tissue work, that may all be performed in the beginning stages of hip labrum tears when we're a little bit more symptomatic. They may educate you on how to utilize a foam roller, and this could be something that you can utilize as part of a home program to mimic some of the hands-on care that you're getting in the clinic. Education and intervention based off of mobility and stretching is often key when we're talking about hip labrum tears. Common muscle groups that are gone after are the quadriceps, your hip flexors, the hamstrings, the glutes, and even your core and lower abdominals and low back musculature. From a strengthening standpoint, and we're talking about stability of the hip, it's going to be a combination of your larger gross movement patterns. Think about squatting, hinging, something like a deadlifting type motion, or to pick something up off of the ground. Different lunging and step-up patterns are all great ways to target the larger muscle groups of the hip that play a direct role in your performance of activities of daily living, leisure, and work-related tasks. Oftentimes, these bigger exercises are going to be supplemented by some of our smaller and more detailed-oriented activities that are going after some of the muscles that play more of a stabilizing role in the hip. Oftentimes you'll hear these referred to as your abductors or your adductors, or maybe your hip rotators. These are active in all the different motions that we do on a daily basis. You just don't always see them working like you can with our glutes and our hamstrings and our quads. A lot of your evaluation process is going to be geared towards figuring what is a safe entry point for exercise, meaning what are we able to tolerate from a symptom standpoint, and what are we able to perform from a functional competency standpoint, so that your physical therapist can figure out the most appropriate exercises for you, but also the most appropriate dosaging of those exercises. Meaning, what's the intensity? Are we just using body weight, or are we adding extra resistance with bands or free weights or other ways to load this activity? What's our set and rep scheme look like, and what's our overall volume or frequency needed to elicit a change and to build strength and to build mobility, but without crossing that threshold of what's comfortable and what's tolerable, and avoiding the likelihood of suffering a setback along the way. So if you've been dealing with pain in the front of your hip that won't go away, it's clicking, it's popping, and it seems to be lingering around longer than what you'd like, or you're having pain levels higher than what you can tolerate, be sure to get in touch with a sports medicine physician, an orthopedic, or a physical therapist, and see what the most appropriate plan of care for you is. Hopefully this video serves as a general overview of what the process looks like and what to potentially expect with care for a hip labrum tear. And keep in mind that some of these will require surgical intervention to formally and completely resolve. Those different surgical interventions carry a whole host of other things that may influence how large or how small of a surgery it is, and what your expectations regarding recovery timeframes may be. And that's a conversation that your orthopedic will have with you based off the findings of their evaluation, your individual case, and what they think is most appropriate for you.